Diaper rashes are typically characterized by bright red, inflamed skin on a baby's bottom. It's uncomfortable for your baby and definitely no fun for parents. Here are some of the most common causes of a diaper rash and how you can make your little one's bottom feel better. A common cause of diaper rash is prolonged exposure to urine or stool. Urine and stool can have acidic properties, and if left in contact with the skin for too long, it can damage the skin barrier. A baby's skin is very tender, and babies can develop a rash if wet or soiled diapers are left on too long. You can minimize this risk by swapping a soiled diaper for a fresh one every 2 to 3 hours and more frequently if your baby currently has a rash. Clean your baby's diaper region thoroughly during changes. What about reactions to a new product? Well, when trying a new brand of wipes, ointments, diapers, laundry detergent, fabric softeners, even ones that are made for sensitive skin, your baby may have a reaction. Avoid scented wipes or soaps on your infant's diaper region if possible, and when you can, look for fragrance-free items for your baby's skin and diaper routine. Tight-fitting diapers against the skin can also cause chafing, which can lead to a rash. Diapers should be snug enough to keep the diaper up, but not so tight that they'll cause skin irritation. Consider the adhesive tabs. They should actually come around the side to the middle and land in the landing strip. If they're too far lateral, that might indicate that your baby's diaper is too small for their bottom. Also consider the leg cuffs. This fringe goes around your baby's thighs. If you're seeing marks on your baby's thighs from the leg cuffs, again, that might be an indication that it's time to size up. What about their diet? When your baby is introduced to a new food, their bowel movements can change and make the diaper rash more likely. Acidic foods like citrusy fruits and even tomatoes are often to blame for irritating baby's diapered area. As a pediatrician, I don't necessarily recommend cutting out those foods. Instead, just be aware. If you do see a rash creep up, remember what your baby may have recently consumed that could be contributing to it. What about when to call the doctor? Most forms of diaper rash will clear up within a few days after some simple remedies to heal the skin barrier. But in some cases where the rash is caused by yeast or a bacterial infection, your baby will likely need a prescription. Watch out for small red bumps, blisters, crusty patches, or abscesses with pus. If you see these or the rash doesn't improve in a few days, make sure to call your child's doctor. So here's the breakdown of precautions to take to prevent a diaper rash. Check your baby's diaper at least every 2 or 3 hours and change it promptly. Clean your baby's diaper region thoroughly during changes. Don't use scented wipes or soaps on your infant's diaper region if possible. Pat, don't scrub a baby's bottom when drying them after a bath. Look out for skin marks, which might indicate that the diaper is too tight. Diaper rash can happen to the most vigilant parent. It's not a reflection of your diaper changing skills, but following some of these simple tips and paying attention to unusual symptoms can really help. Okay, parents and caregivers, you got this.